Why is accurate record keeping crucial in animal care, and what are the legal implications of failing to maintain proper documentation for an animal's health and welfare? Answer: accurate record keeping is essential in animal care for several reasons. Health monitoring. It ensures continuity in animal care, especially when multiple caregivers are involved. By maintaining detailed health records, caretakers can track the animal's progress, identify trends in health, and address issues promptly. Legal compliance. Accurate records are required by law to meet animal welfare regulations. For instance, in Australia, the Animal Welfare Act mandates the recording of certain medical treatments, vaccinations, and behavioral assessments. Failure to maintain accurate records could lead to legal penalties for non-compliance with these regulations. Transparency and accountability. It provides transparency for veterinary professionals, regulatory bodies, and animal owners, ensuring that the animal's treatment aligns with best practices. Traceability and liability. In case of litigation or disputes, accurate records serve as evidence of the care provided. This includes information about treatments, diagnoses, and any incidents that may affect the animal's well-being. Discuss the various methods of documenting animal health and welfare, highlighting the differences between electronic and paper-based systems. Answer: there are two primary methods for documenting animal health and welfare: electronic systems and paper-based systems. Electronic record systems. Advantages: quick retrieval of data, easy to update and maintain, enables centralized data management, which is particularly useful for large facilities or multiple locations, allows for the integration of other technologies, such as mobile apps for on-the-go record updating or automated health monitoring systems, reduces the risk of human error in documentation. Disadvantages: requires consistent power supply and IT infrastructure, potential security risks related to data privacy and unauthorized access, that can be costly to set up and maintain. Paper-based record systems. Advantages: lower initial setup cost, simple to implement in small-scale operations with minimal technology needs, no dependency on electricity or internet connectivity. Disadvantages: time-consuming to update and store, risk of loss or damage, e.g. through fire or water, harder to share information across locations or teams, prone to human error such as illegible handwriting or missing entries. Legal perspective: both systems must comply with regulations for animal welfare, including ensuring that all relevant information, treatments, vaccinations, observations is documented correctly. Depending on jurisdiction, electronic records may need to adhere to specific data protection laws, e.g., the General Data Protection Regulation in the EU. Mr. Harris is a caretaker at an animal shelter. He has just administered a vaccine to a dog, and he needs to update the animal's treatment record. The shelter uses a paper-based record system for documenting treatments. What steps should Mr. Harris take to ensure that the documentation is accurate and compliant with legal standards? Answer: Mr. Harris should take the following steps to ensure proper documentation of the vaccine administration. Immediate entry. He should immediately enter the details of the vaccine administration into the paper record. This includes the type of vaccine, the date administered, the veterinarian's name, and any observed reactions to the vaccine. Legibility and accuracy. The details must be clearly written with legible handwriting. All abbreviations should be standardized and easy to understand. Cross-reference with treatment history. Mr. Harris should cross-check the dog's prior health records to ensure that the vaccine is being administered according to the schedule and that no prior treatments may affect the new one. Signed by authorized personnel. If Mr. Harris is not a licensed veterinarian, he must ensure that the treatment entry is reviewed and signed off by a qualified veterinarian or authorized personnel as required by law. Legal compliance. Mr. Harris should ensure the record is in compliance with relevant animal welfare regulations, e.g. Animal Welfare Act 2002 Australia, which may specify certain data points that must be recorded, such as vaccine type, batch number, and the condition of the animal post-treatment. What are the key ethical considerations in animal research, and how do they impact the decisions made by researchers? Answer: ethical considerations in animal research include the 3Rs principle. Researchers must adhere to the principle of replacement, reduction, and refinement. Replacement: where possible, researchers should replace animal models with alternative methods, e.g. cell cultures or computer simulations. Reduction: the number of animals used should be minimized by optimizing experimental design and sharing results to avoid redundant studies. Refinement: researchers must refine their methods to minimize pain, distress, and suffering for the animals used. Justification of animal use: researchers must demonstrate that the potential benefits of the research outweigh the harm to the animals. This is critical for the ethical approval of any study involving animals. Humane treatment: all animals used in research must be treated humanely throughout the study. This includes providing appropriate housing, nutrition, and healthcare to ensure their well-being. Informed consent in the case of animal research involving human subjects, e.g., veterinary trials. The participants, veterinarians, caretakers should be informed of the research purpose and its potential risks. Regulatory compliance. Ethical considerations are also regulated by laws such as the Animal Research Act 1985, Australia, which mandates ethical review processes and licensing for animal research. Describe the key welfare considerations that must be addressed in laboratory animal care and explain how they contribute to the ethical treatment of animals in research. Answer. Key welfare considerations in laboratory animal care include physical environment, ensuring that the animals have a suitable environment that supports their physical and psychological well-being. This includes adequate space to move and express natural behaviors, proper temperature, humidity, and ventilation controls, enrichment strategies to minimize stress and promote natural behavior, nutrition and hydration. Animals must have access to appropriate food and clean water adjusted for the species, age, and health status. Health monitoring. Continuous monitoring for signs of disease, injury, or distress is essential. Regular veterinary care should be available to address any health issues. Minimizing pain and distress. Procedures that may cause pain or distress must be avoided or minimized. When procedures are unavoidable, animals must be provided with appropriate anesthesia or analgesia. Behavioral welfare. Researchers should consider the behavioral needs of animals, such as socialization and opportunities for physical activity. What are the primary alternatives to animal testing, and how have these methods evolved over time? Answer. Alternatives to animal testing have evolved significantly due to ethical, scientific, and regulatory pressures. Key alternatives include in vitro testing. This involves the use of cultured cells or tissues to test for toxicity or drug effects, offering a way to assess biological responses without using animals. Computer modeling and simulation. Advances in computational biology and chemistry have enabled researchers to simulate biological processes and predict how substances may affect living organisms, reducing the need for live animal testing. Organ-on-a-chip technology. A newer innovation where microfluidic devices simulate human organ systems to study disease, toxicity, or drug reactions. This approach offers a more precise human-relevant alternative to animal testing. Human volunteers, in some cases, controlled human trials or microdosing, administering very small amounts of a substance can replace animal models. Ethical and regulatory support. The EU cosmetics regulation and similar laws globally now prohibit animal testing for cosmetic products, fostering the development of alternative testing methods. How should animal caretakers track and manage the vaccination history of animals under their care, and what are the potential consequences of failing to maintain these records? Answer. Animal caretakers should use a systematic approach to track vaccinations, such as comprehensive record keeping. A record should be created for each animal detailing the type of vaccine administered, the date of administration, the veterinarian's name and batch number, any side effects or reactions. Timely updates. Caretakers must regularly update vaccination records, ensuring that all subsequent treatments, boosters, or follow-ups are documented promptly. Legal requirements. In many jurisdictions, maintaining vaccination records is legally required, particularly for diseases that could affect public health, e.g., rabies in pets. Failure to keep these records can result in penalties, fines, or even the closure of animal care facilities as outlined in laws like the Animal Diseases Act. Vaccination schedules. Vaccination should be administered in accordance with recommended schedules to ensure animals are adequately protected. An animal care professional is asked to participate in a research study that may cause discomfort to the animal. How should they respond, considering the ethical guidelines of animal care? Answer. The animal care professional should carefully consider the ethical implications of participating in the study. They should assess whether the research follows the 3R's principle: replacement, reduction, refinement. The professional should question if there are alternative methods that could avoid or minimize discomfort to the animal. If the potential for harm outweighs the benefits, the professional should refuse participation and report concerns to the Ethical Review Committee or regulatory body overseeing the research. The professional must also ensure that the research complies with animal welfare laws, e.g., the Animal Welfare Act, and that proper veterinary care is available to manage any discomfort or harm. How do research institutions ensure compliance with animal welfare laws, and what are the consequences for non-compliance? Answer. Research institutions must implement stringent protocols to ensure compliance with animal welfare laws. Ethical review boards. All research involving animals must undergo review by an institutional animal care and use committee (IACUC), which ensures that research protocols meet ethical standards. Licensing and training. Researchers must be appropriately licensed, and animal caretakers must receive training in ethical animal care and welfare, regular inspections and audits. Regulatory bodies may conduct unannounced inspections and audits to ensure that research facilities comply with animal welfare regulations. Consequences for non-compliance. Failure to comply with regulations may result in suspension of the research project, fines or legal penalties, loss of research funding or licensing, damage to the institution's reputation. What are the key ethical and legal issues surrounding animal welfare in commercial breeding operations? Answer: key ethical and legal issues in commercial breeding include overbreeding and genetic issues. In some commercial breeding operations, animals are bred for specific traits that can lead to genetic defects, health problems, or reduced quality of life. Living conditions. Animals in commercial breeding operations may suffer from overcrowding, lack of socialization, and poor living conditions, all of which violate ethical guidelines for animal welfare. Legal oversight. Many countries have enacted laws such as the Animal Welfare, Breeding and Sale regulations that require breeders to maintain specific standards of care. Non-compliance with these regulations can lead to fines, imprisonment, and the loss of breeding licenses. Transparency and inspections. Regular inspections are mandated to ensure compliance with welfare standards. Breeders must maintain records for every animal documenting their health, breeding history, and care. What is the primary consideration when handling exotic animals in a rehabilitation setting, and why is it important to ensure their welfare is prioritized? Answer: when handling exotic animals in a rehabilitation setting, the primary consideration is minimizing stress while meeting the animal's physiological, social, and psychological needs. Exotic animals, unlike domesticated pets, have specialized needs due to their wild nature. Ensuring proper welfare is crucial because stress can impair the animal's ability to recover and adjust to a wild environment. For example, reptiles require precise temperature gradients, and exotic birds may need specific environmental conditions such as humidity and space to fly. Handling should be as calm and non-invasive as possible to avoid inducing shock or stress. Moreover, providing the correct diet and enrichment activities that mimic natural behaviors is essential. The Australian Animal Welfare Standards and Guidelines highlight that wildlife rehabilitation should focus on minimizing human contact, as prolonged exposure can cause dependency and hinder the animal's reintegration into its natural habitat. Thus, prioritizing welfare is not only essential for recovery, but also for the long-term success of releasing animals back into the wild. Eco-livestock care scenario. Why is biosecurity critical for preventing the spread of disease between cattle herds, and what are some key biosecurity measures? Answer: biosecurity is vital in preventing disease outbreaks in livestock, as diseases like foot and mouth disease or bovine tuberculosis can rapidly spread within herds, leading to significant financial losses. By maintaining a strict biosecurity plan, farmers can reduce the risk of introducing or spreading infections. Key biosecurity measures include isolating new animals before they join the herd, cleaning and disinfecting equipment, vehicles, and facilities regularly, and restricting access to the farm to limit the introduction of pathogens. The Australian Biosecurity Act 2015 requires producers to implement measures that prevent the transmission of infectious diseases. Furthermore, farmers must monitor cattle for signs of illness and report outbreaks promptly. Vaccination programs, regular veterinary checkups, and maintaining clean, dry housing for cattle are also essential practices for minimizing disease risks. The Australian Animal Welfare Standards for Cattle mandate that cattle be housed in conditions that reduce stress and facilitate good health, which in turn helps prevent the spread of disease. Sarah works at an animal shelter that handles a variety of animals, including dogs, cats, and exotic birds. One morning, she notices that a cat in the shelter is showing symptoms of respiratory distress and a persistent cough. What steps should Sarah take to ensure proper care for the cat and prevent the spread of any potential disease? Answer: Sarah should immediately isolate the cat from the other animals to prevent the possible spread of respiratory infections, which could be contagious. She must then report the symptoms to the shelter's veterinarian for further diagnosis and treatment. While waiting for the vet's arrival, Sarah should wear appropriate personal protective equipment, PPE, including gloves and a mask, to avoid cross-contamination. The shelter should have a designated quarantine area to house animals with symptoms of infectious diseases. The vet may conduct tests to diagnose the condition and recommend treatments, such as antibiotics or antiviral medications. Additionally, Sarah should ensure that the shelter's cleaning protocols are followed rigorously, disinfecting surfaces and equipment that may have come into contact with the infected animal. The Australian animal welfare standards stipulate the importance of isolating sick animals to ensure proper care and prevent the spread of diseases, especially in environments like shelters where animals of various species are kept together. Why is it essential to understand the behavior and social structure of small mammals like guinea pigs when providing care in a veterinary or domestic setting? Answer: understanding the behavior and social structure of small mammals like guinea pigs is essential for providing appropriate care and ensuring their welfare. Guinea pigs are highly social creatures that thrive in groups. Keeping a solitary guinea pig for extended periods can lead to depression, anxiety, and behavioral problems. Understanding their natural behaviors helps caregivers manage their needs, such as providing proper space, enrichment, and companionship. Guinea pigs, being prey animals, often show signs of stress when exposed to unfamiliar environments or sudden movements. Recognizing these signs allows caregivers to take proactive steps to reduce stress and avoid injury. For instance, when transporting guinea pigs, they should be placed in secure, quiet carriers to reduce anxiety. The Australian animal welfare standards for companion animals emphasize the importance of providing social interaction and environmental enrichment to animals in domestic and veterinary settings to promote their mental and physical well-being. Understanding these aspects of behavior ensures that guinea pigs are treated in a way that prevents unnecessary stress and supports their overall health. What are the risks of handling hazardous chemicals in an animal care setting, and how should workers mitigate these risks? Answer: handling hazardous chemicals in animal care settings presents several risks, including chemical burns, respiratory issues, or poisoning if the chemicals are mishandled or come into contact with skin, eyes, or mucous membranes. These risks can arise when using cleaning agents, disinfectants, or medications that may contain toxic ingredients. To mitigate these risks, workers must follow safety protocols such as wearing appropriate personal protective equipment, PPE, including gloves, goggles, and face masks. They should also ensure proper ventilation in areas where chemicals are used. The Work Health and Safety Act 2011 and Safe Work Australia guidelines mandate that hazardous substances be labelled correctly, and Materials Safety Data Sheet (MSDS) should be available for all chemicals to provide information on handling, storage, and emergency procedures. Workers should be trained in chemical safety and understand how to respond to spills, exposures, or accidents. Proper disposal methods must also be followed to ensure that chemicals are safely discarded, minimizing risks to animals, humans, and the environment. What are the key components of infection control protocols in a veterinary practice, and why are they critical for maintaining a safe environment for both animals and humans? Answer: infection control protocols in veterinary practices are critical for reducing the risk of disease transmission between animals and humans, especially zoonotic diseases. The key components include the following: hand hygiene, washing hands thoroughly before and after handling animals to prevent cross-contamination, use of PPE, wearing gloves, masks, and gowns when dealing with sick animals or biological materials, sanitization, disinfecting surfaces, equipment, and tools between uses to eliminate pathogens, isolation, keeping animals showing symptoms of contagious diseases separate from healthy animals to prevent outbreaks, waste management, ensuring that waste, such as animal bedding and excreta, is handled and disposed of safely according to the Australian Infection Control Guidelines. Following strict infection control procedures is necessary to minimize the risk of infection and ensure the safety and health of both animal patients and veterinary staff. Mr. Williams is working in a farm that raises pigs. He notices that a few pigs have developed skin lesions and appear lethargic. What should Mr. Williams do to address the situation while ensuring the health of the entire herd? Answer: Mr. Williams should immediately isolate the affected pigs to prevent the spread of any potential infectious disease. He should notify the farm veterinarian and provide as much detail as possible about the symptoms observed, such as the appearance of the lesions and the lethargy. While waiting for the veterinarian, Mr. Williams should restrict access to the pigs to minimize the risk of disease transmission. The veterinarian may suggest diagnostic tests to identify the condition and determine whether it is contagious. In the meantime, Mr. Williams should review the farm's biosecurity protocols to ensure that no other animals or equipment are exposed to the affected pigs. The Australian Biosecurity Act 2015 mandates that farmers take immediate action to contain any potential disease outbreaks. The veterinarian will recommend treatment and may advise quarantine measures or adjustments to the farm's management practices to prevent further spread. Mr. Williams should also check the health of the remaining pigs and monitor for any new symptoms. What is the role of personal protective equipment, PPE, in preventing workplace injuries in animal care settings, and what types of PPE should be used? Answer: Personal protective equipment (PPE) plays a crucial role in preventing injuries in animal care settings by protecting workers from physical hazards, zoonotic diseases, and chemicals. The types of PPE commonly used include gloves to protect hands from animal bites, scratches, and exposure to hazardous materials, face shields or masks to protect against airborne pathogens, particularly when dealing with animals that may carry respiratory infections, protective clothing, gowns, or aprons to shield workers from bodily fluids or other contaminants, footwear, durable, slip-resistant boots that protect workers from injury and prevent contamination. The Work Health and Safety Act 2011 requires employers to provide PPE for staff and ensure that it is used correctly to minimize risks. Regular training on PPE use and maintenance is essential for ensuring its effectiveness. Additionally, workers should be trained in safe animal handling and proper hygiene practices to further reduce the risk of injury. Lisa is a wildlife rehabilitator caring for a native bird that has been injured. The bird is in shock and Lisa needs to provide immediate care. What actions should Lisa take to stabilize the bird and ensure its safety? Answer: Lisa should immediately assess the bird's condition and move it to a quiet, warm environment to reduce stress and stabilize its body temperature. She should handle the bird gently, avoiding any unnecessary movement or injury. Lisa should provide oxygen if available and administer fluids using a syringe or dropper if the bird is dehydrated. It's crucial to keep the bird in a safe position to prevent further injury. Lisa should then contact a veterinarian or wildlife specialist to assess the extent of the injuries and determine the appropriate treatment. During this time, she must monitor the bird for signs of improvement or worsening symptoms. According to the Australian Animal Welfare Standards for Wildlife, handling wild animals should be done with minimal interference to avoid stress, which can exacerbate the animal's condition. If the bird is in shock, prompt care is essential to prevent further complications. Why is training and education important for individuals working with animals in veterinary or animal care settings, and what should such training include? Answer: Training and education are critical for individuals working in veterinary or animal care settings to ensure they understand animal behavior, health needs, and safety procedures. Well-trained staff can provide higher quality care, recognize symptoms of illness, and handle animals safely, reducing the risk of injury or stress. Training should include animal welfare standards, knowledge of appropriate handling, nutrition, and housing based on species-specific needs, health and safety protocols, understanding infection control measures and how to prevent zoonotic disease transmission, emergency response, how to handle injuries, administer first aid and recognize signs of distress or illness, animal behavior and psychology, recognizing behavioral signs of stress, fear, or illness to ensure the animals are treated with respect and care. The Australian Animal Welfare Standards emphasise the importance of providing ongoing education to ensure that staff are up to date on the latest animal care practices and legal requirements. Proper training is not only essential for animal welfare but also for creating a safe and effective work environment. What are some common stress indicators in animals, and how can these signs impact their health and welfare? What specific methods can be employed to mitigate stress in an animal under care? Answer: Animals like humans exhibit physical and behavioral stress indicators. Common signs include changes in body posture, e.g. hunched or tense posture, excessive grooming, pacing, changes in eating or drinking habits, vocalization, and abnormal behaviors like aggression or withdrawal. Physiologically, stress can lead to elevated heart rates, shallow breathing, and immune suppression. In practice, stress management is essential to ensure animal welfare. Techniques such as providing a quiet and safe environment, maintaining consistent routines, using calming pheromones or enrichment activities, and ensuring proper socialization are recommended. These methods align with welfare regulations such as the Australian Animal Welfare Standards and Guidelines under the Animal Welfare Act 1992, which require that stress-inducing factors be minimized in an animal's environment. How does an animal's body language communicate its emotional state, and what are the critical signals to look for in a dog to assess its comfort level in an unfamiliar environment? Answer: Animal body language is a fundamental method of communication. In dogs, body posture, tail position, ear orientation, and facial expressions are critical indicators. For example, a wagging tail can indicate excitement, but the speed and height of the wag can signal different emotional states. A relaxed dog will have a neutral stance, ears up or slightly back, and eyes soft. On the other hand, a dog that feels threatened may stiffen, lower its body, and tuck its tail while showing bare teeth and a fixed gaze. In unfamiliar environments, dogs may exhibit stress indicators like lip licking, yawning, or avoidance behavior. Recognizing these signs is crucial in managing their welfare in line with national animal welfare law, which stipulates the need for environments that respect the animal's natural behaviors and emotional states. Mr. Thompson, a farm manager, notices that one of his sheep has been lethargic, has a reduced appetite, and is showing signs of labored breathing. What should Mr. Thompson do to address this situation, considering animal welfare standards? Answer: in this situation, Mr. Thompson must first isolate the affected sheep to prevent the potential spread of any infectious disease. He should then assess the severity of the symptoms. Lethargy, poor appetite, and labored breathing could indicate a respiratory infection such as pneumonia or a more systemic condition like parasite infection. Immediate action would involve contacting a veterinarian for a thorough examination. In the meantime, the sheep should be kept in a clean, stress-free environment with adequate ventilation and warmth. From a welfare perspective, the Australian Animal Welfare Standards and Guidelines for sheep require that animals exhibiting symptoms of illness or distress receive prompt attention and care. These guidelines mandate that any animals showing signs of significant discomfort or health decline should be treated according to the recommendations of a qualified professional. Explain the role of the immune system in preventing diseases in animals and identify the most common preventative measures used in animal care to maintain optimal health. Answer: the immune system plays a vital role in protecting animals from pathogens such as bacteria, viruses, and parasites. It comprises two main branches: the innate immune system, the first line of defense, and the adaptive immune system, which provides long-term immunity. The innate system includes barriers such as skin and mucous membranes, while the adaptive system involves the production of antibodies by B cells and T cells that specifically target pathogens. To support the immune system, proper nutrition, vaccination, parasite control, and minimizing stress are critical factors. Preventative measures include regular vaccinations as per the species-specific schedule, appropriate deworming protocols, and regular health checkups. National animal welfare standards encourage routine immunization and biosecurity measures to prevent the spread of infectious diseases among animals. Sarah at Wildlife Care finds a wounded kangaroo with a deep laceration on its hind leg with significant bleeding. What steps should Sarah take immediately to address the situation, and what should be considered when transporting the animal to a veterinary facility? Answer: in this scenario, Sarah should prioritize stopping the bleeding by applying gentle but firm pressure with a clean cloth or bandage. If bleeding persists, she may need to apply a tourniquet above the injury, but only if it's severe and life-threatening. Sarah should then assess the wound for signs of infection or further trauma. Once the bleeding is controlled, Sarah should avoid unnecessary movement of the kangaroo, as this can cause further stress or injury. Transporting the animal should be done in a way that minimizes movement. Using a stretcher or padded transport box, it's important to ensure the animal remains calm and warm during the journey. According to wildlife care guidelines, such injured animals should be transported to the nearest veterinary facility immediately for professional care under the Wildlife Act regulations. Why is it critical to understand the dietary requirements of different animal species, and how does the nutritional composition of food affect their growth, reproduction, and overall health? Answer: different animal species have varied dietary needs depending on their physiology, metabolism, and natural environment. For example, carnivores require a diet high in proteins and fats, while herbivores rely on fiber-rich plant material for digestion and energy. Omnivores, like pigs, need a balanced mix of plant and animal matter. Proper nutrition affects all aspects of an animal's health, including growth, reproduction, immune function, and disease resistance. For instance, inadequate protein intake can lead to stunted growth and poor immune function, while vitamin deficiencies may lead to conditions such as scurvy in guinea pigs or rickets in young mammals. It is crucial to meet each animal's unique nutritional needs in line with Australian Animal Nutrition Guidelines. A well-balanced diet tailored to each species' requirements supports optimal health and welfare throughout their life stages. What are some common behavioral modification techniques used to address aggressive behavior in cats, and what ethical considerations should be taken into account when using these techniques? Answer: behavioral modification in cats is often achieved through techniques such as positive reinforcement, rewarding desirable behaviors, clicker training, and environmental enrichment. For aggression, strategies may include redirecting the cat's attention, providing more structured playtime, and minimizing stressors in the environment. Ethical considerations include ensuring that the training does not cause unnecessary distress or harm to the animal. Harsh or punitive methods, such as physical punishment, should never be used, as they can lead to increased aggression and fear. These practices align with Animal Welfare Act 2002, which emphasizes humane and effective methods for managing animal behavior. Describe the key components of the circulatory system in mammals and explain how the heart's role in circulation is vital for maintaining homeostasis in the body. Answer: the circulatory system in mammals consists of the heart, blood vessels, arteries, veins, and capillaries, and blood. The heart pumps blood through two primary circuits: the pulmonary circuit to the lungs for oxygenation, and the systemic circuit to the body's tissues. The heart itself is a four-chambered organ, with the right side pumping deoxygenated blood to the lungs and the left side pumping oxygenated blood to the rest of the body. This circulation is essential for maintaining homeostasis by delivering oxygen and nutrients to tissues while removing metabolic waste products like carbon dioxide. Blood also helps regulate body temperature and pH. Any disruption to this system, such as cardiac arrhythmias or heart failure, can severely compromise an animal's health. Therefore, maintaining a healthy circulatory system is crucial for the overall welfare of the animal. What are the primary causes and symptoms of canine parvovirus, and what is the recommended protocol for preventing and treating this condition in puppies? Answer: canine parvovirus is a highly contagious viral disease that primarily affects puppies, especially those that have not been vaccinated. It is characterized by severe gastrointestinal symptoms, including vomiting, diarrhea, often bloody, lethargy, and dehydration. In severe cases, it can lead to shock and death. Prevention involves vaccination with a DHPP vaccine, distemper, hepatitis, parvovirus, parainfluenza, given in a series starting at 6-8 weeks of age. The disease can also be prevented by avoiding exposure to infected animals. Treatment includes supportive care such as intravenous fluids, electrolyte replacement, and antibiotics to prevent secondary bacterial infections. There is no specific antiviral treatment. The Australian Companion Animal Health Guidelines emphasize the importance of vaccination and early detection in managing this disease. How do the respiratory systems of reptiles differ from mammals, and how do these differences affect their ability to regulate oxygen levels and survive in various environments? Answer: reptiles, unlike mammals, have a less efficient respiratory system. Most reptiles have a simple lung structure relying on buccal pumping, pushing air into the lungs via a mouth rather than the diaphragm for respiration. This makes their oxygen exchange less efficient, especially during periods of high activity. Additionally, reptiles have a low metabolic rate and require less oxygen, making them well suited for environments with lower oxygen levels. However, this adaptation can limit their endurance and activity in colder climates, as they are ectothermic, relying on external heat sources. In contrast, mammals have a more efficient alveolar lung structure and use the diaphragm for active ventilation, which allows for better oxygen exchange, especially in warm-blooded conditions.